This is the Behind the Line podcast, coming to you from the wacky left coast capital of Seattle. News from the Pacific Northwest, the left coast, the U.S., and the world that matters. The stories the MSM won't talk about. Deciphering the truth through all the lies. For more, visit BehindTheLinePodcast.com.
Well, are they ready to give us the next pandemic? Have we got a little insight into what may be next up for us? The FDA made an announcement last week that they are preparing for the bird flu pandemic. The FDA is gearing up for a bird flu pandemic in people that could kill one in four of those it infects, the agency's top official has revealed. Dr. Robert Califf told a Senate committee that officials were drawing up plans to roll out tests, antiviral drugs, and vaccines in the event the virus jumps to humans. Because only 2 people in the United States have ever been infected with bird flu. But apparently, this now is number 1 on their radar. Why would that be? But he emphasized the risk of it spreading to people was still low. So why are they devoting so much resource to this? Only 1 person infected so far, a farm worker in Texas in March. And there was another person infected in the past. This virus, like all viruses, is mutating. He told the policymakers we need to continue to prepare for the possibility that it might jump to humans. The real worry is that it will jump to the human lungs, where, when that has happened in other parts of the world, the mortality rate has been 25%. Bird flu already appears to be spreading in cattle for the first time after jumping from birds. As the virus spreads, particularly between 2 different species, it acquires more mutations which may allow it to infect people more easily. Fragments of the virus have already been detected in products including 1 in 5 grocery store milks, as well as cottage cheese and sour cream. But officials say these are still safe to consume because the virus inside them is inactivated during the pasteurization process. Dr. Califf, who was speaking to the Agricultural Committee, added, "We got to have testing, got to have antivirals, and we need to have a vaccine ready to go." You ready to line up for that again? You ready to not be able to work if you don't have it, or go out to a restaurant if you don't have it? We have been busy getting prepared for if the virus does mutate in a way that allows it to jump into humans on a larger level. Championing America's position, Dr. Califf added, we're in an inevitable position compared to any time in the history of the world. We're in an enviable position compared to any time in the history of the world. Viruses are relatively simple, so coming up with a matching vaccine is entirely possible in a short period of time. Yes, another untested, unknown vaccine in a short period of time. The U.S. already has a stockpile of about 20 million bird flu vaccines in its national stockpile, officials say, which are well matched to the H5N1 virus. It also has the capacity to quickly make 100 million more if necessary, they added. There are also supplies of antivirals, such as oseltamivir, used to treat the latest bird flu patient, available, although officials have not provided a number. Similarly, there is work ongoing to develop a bird flu vaccine for poultry, and tests showing human antivirals work just as well on sick cows. Only 2 humans in the U.S. have tested positive for bird flu ever, with both being in close contact with animals infected with the virus. There have been no signs in either case of the individual spreading the disease to others. A total of 36 farms across 9 states have so far detected the virus among their dairy herds. It comes after CDC officials restated their warning that bird flu had pandemic potential in a new report. Writing in the New England Journal of Medicine, they made the warning in a section about rolling out vaccines if the virus spills over to humans. Also last week, a separate study by the U.S. Department of Agriculture released genetic data showing the H5N1 strain tearing through dairy farms had acquired dozens of new mutations. These changes could make the strain more likely to spread from cows to other animals, including people, and make the virus resistant to antivirals. Since 2022, bird flu has been recorded in over 80 countries. It first began circulating in parts of Africa, Asia, and Europe in late 2021, and has since reached all continents except Australia. The virus is fast mutating and highly pathogenic and is found in multiple bird species. Around the world, the mortality rate of the bird flu is about 50% in the almost 900 people who were infected between 2003 and 2024. Still a very low number, speaking of the worldwide population. Bird flu originated or was first detected in 1996 in, can you guess where? China. In February of 2022, the virus began causing sporadic outbreaks of H5N1 in backyard and commercial poultry flocks in the U.S., causing serious illness and death in infected chickens. The number of outbreaks has increased and spread over time. As of May 2024, the CDC reported poultry outbreaks in 48 states. In addition, there have been sporadic infection in mammals, including bears, bobcats, minks, mountain lions, raccoons, skunks, and others, according to the CDC. And now, as of early May, there have been outbreaks in dairy cattle in 9 states. They go on to say, while the risk of bird flu infection is very low, for most people in the U.S., people who work with birds or poultry, own them, or have recreational exposure to them are higher risk than other people. Dr. Roberts from Yale Medicine says, I would say that anyone who works on a farm in a state that has reported animal infections where the farmer has identified illness in their animals should monitor for flu-like symptoms and contact public health officials if any symptoms develop. What are the symptoms of bird flu? Cough, fatigue, fever, headaches, muscle or body aches, runny nose, and shortness of breath. There are currently no vaccines for bird flu, but the CDC reports that there have been preliminary work towards a targeted vaccine in case one is needed, like I just mentioned. Also, the previous antiviral oseltamivir, which is actually under the brand name Tamiflu, can be used to treat it. Both are oral prescription medications. The other one is Exofluza. Prescription medications that should be taken as soon as possible within 48 hours of experiencing symptoms. The CDC has a recommended list of precautions. Avoid sick or dead birds. Don't touch surfaces or materials that could be contaminated. That includes animal litter or feces, mucus, raw milk, or saliva. Avoid poultry farms and bird markets. If you must visit those places, wear a well-fitting face mask. Oh, here we go with the face mask. It should be noted that they also say they don't know how it spreads yet. So there's that. And don't touch the animals. Use the following protective measures if you are unable to avoid contact with wild birds or sick or dead animals. Wear gloves, and after removing them, wash your hands properly. Wear an N95 respirator or well-fitted mask. Use eye protection such as goggles. Throw your gloves away and face mask after any exposure. For a specific situation and groups, including hunters and people who raise chickens in their backyards, you should check the CDC website for further advice. So on the CDC website, it says for people who have poultry in their yards to use the protective equipment like I mentioned. Wash your hands. Avoid touching your mouth, nose, or eyes after contact with birds or surfaces and materials that may be contaminated with saliva, mucus, or feces from wild or domestic birds. Change your clothes before contact with healthy domestic poultry and after handling infected or potentially infected birds and other animals with confirmed or suspected bird flu virus infection. Then throw away the gloves and face mask and wash your hands with soap and water. They also say if you have backyard or hobbyist flocks that you should report any sick animals to the USDA at an 800 number. If you've been exposed and become sick within 10 days of exposure, you should isolate at home away from other household members and should not go to work or school until they are proven not to have bird flu virus infection. The local or state public health departments should be notified and consist in monitoring. Close contacts of people who have been exposed to bird flu viruses should monitor their health and report to their health care provider any new symptoms, especially respiratory symptoms or eye redness or conjunctivitis within 10 days of the last exposure. So how long is it going to be before this becomes an issue? Why, if there's one person in recent history who's been infected and he was a farm worker, are they pushing on this so hard? Are they devoting so much resource, giving congressional testimony? Now somehow this virus has jumped to cattle. It's in the milk. How long before you can't drink milk? I mean, as of right now, they're saying pasteurization takes care of it. Is that going to continue? Are they going to start destroying cattle herds like they did the birds a couple years ago when this happened? I think that was during COVID. They killed hundreds of thousands of, or maybe millions of chickens. They don't want you to eat meat as it is. And here is a good excuse to cull American cattle. We are coming up on this election year. They're going to be looking for all kinds of excuses to create chaos. I mean, we're seeing it daily as it is. And now here is just another box for them to check on their list, you know? How long before the next pandemic? How long before we can't buy beef or chicken or milk or, my favorite, sour cream? How long before mass vaccines for bird flu or potential bird flu start being circulated? Mass vaccines that they don't have but can make in a short period of time. We've heard all this before, have we not? Look at all the health problems that exist now as a result. By their own admission, on their own website, on their own vaccine incident reporting system. Heart problems, ringing in the ears, fatigue, allergies, the list goes on. We're going to do all that again? Some experimental vaccine that you have to take, or you can't go to work, or go to the grocery store, or go shopping, go out to eat, do anything. Are we going to start wearing masks again? And I'll say it again, they don't know how this spreads. Those useless masks that we all got to put on, or were told to put on everywhere we went for no reason whatsoever. And you still see people wearing those things in a car by themselves and other places. Look at what happened the last time. People lined up, did what they were told, rolled over. They already know that this works, that they can do this, that they can make us stay home, lock us down, shut everything down, close businesses. And people are just going to do it. What better way to control people? Round 2's coming up. This is your early warning. They are projecting what is going to happen. Right now, by planting a seed in your mind, putting the word out there that this is going to be a problem, they're already working on it. We're going to see a repeat of 2019, 2020, and 2021. Now, whether that's before the election or after doesn't really matter, but you have an opportunity right now to get ready for that. Whatever that means for you and your family, to have supplies, to have toilet paper, to have food, so you don't have to worry about not being able to leave your house or being under their thumb when this comes, because it's going to. Keep an eye on this. Do what you can now before things get crazy, before prices go any higher than what they are. Do what you can now to get ready for this.
Thanks for listening to the Behind the Line podcast. For more, visit behindthelinepodcast.com, leftcoastnews.net, or shtf.net. You can listen to our podcast on Spotify, Amazon Podcasts, Apple Podcasts, Google Podcasts, iHeartRadio Podcasts, and anywhere else podcasts are found. Please subscribe, like, and share to get our content out there. You can also follow us on Facebook, Instagram, X, Truth Social, Gab, Telegram, Substack, Brighteon, Rumble, the Newscaster Studio, and all other forms of social media. Thanks for listening.